All right, so with me today, I have Heather, who owns Heather for Health, a health coaching business. So we're going to ask her some questions and kind of see who she likes to help and what she likes to do. So Heather, tell me a little bit about your business, and we'll kind of start there.
Yeah, so I provide nutrition and lifestyle education and coaching. My clients come to me for kind of different reasons. Most people honestly want to lose a little bit of weight. Um, Getting lean is a high priority for a lot of people. If someone's a recreational athlete, they oftentimes want to increase their energy, get their body fat down. And then I have others who are sent to me by their doctor, and they need to get the blood pressure down, get inflammation under control. So that's a pretty common one too. I mean, I work with people of all ages, from all levels of health, really. Yeah. And my business is virtual. So my clients are, because I'm in West Virginia, I serve a lot of West Virginians, but I have clients from New York to California,
Okay.
so all over.
So how do most people find you?
Most people find me through a referral through another client. So I'm
Okay.
really confident in telling my clients that if they share their health journey with the people in their life, then they are more likely to be successful long term.
Mm-hmm.
So, I mean, you've probably have seen this in your
Yeah.
patients too. But if they're willing to say to their friends and family, like, look, I'm getting healthy and there's no turning back, then obviously, A, they are going to have all that social accountability, but B, they're going to have an opportunity to share with their friends, yeah, you could get healthy too. We could have more fun together. We could run a race together, or we could
Yeah.
go shopping for new clothes together. So it kind of trickles out like that. So that's like probably my number one referral source, just my clients, just being
Yeah.
great advocates for themselves and for me.
Yeah, that's always good. And that's kind of where we get most of our clients too, is just patient referrals. And that always says a lot about you as a person and your success and results with your clients if they're ecstatic and, send you more people that just, and those people are an easy sale too because they've already heard, how wonderful you are and the good results. So they're
Right.
like bought in by the time they call you. So that's awesome.
Yeah.
You mentioned like some doctor referrals. Do you work locally with any doctors specifically that send you people, or is it that mainly just people also like your patients referring you?
Well, both. OBGYNs are awesome referrals because they're
Okay.
helping, mamas feel confident after baby and
Yeah.
get well again, or get their bodies back. And then women who are, premenopausal or even postmenopausal are like, okay, like how come my body's changing? Like I want to feel good again. I have sometimes physical therapists, chiropractors, even orthopedic surgeons who are like, yep, I need, they're sending me their patients because they need to prepare them for recovery,
Mhm.
or on the front end, prepare them for surgery. That
Yeah.
sometimes happens too. If we can get your inflammation down, you're going to have better outcomes. If we can get you into some healthy habits and, at a healthy, weight, to be honest, then you're going to have better results in the gym. You're going to have better results in your recovery and, reduce pain because your body's in alignment, right? If you're not, out of balance, if you're feeling at a healthy BMI, and if you're feeling
Right.
able if you have the energy to move more, which is what I love to help people do, then they're able to get in the gym, or they're able to get to the therapist and get the work done that needs to happen to strengthen their bodies. So yeah.
Yeah. As a PT, I'm an advocate for that prehab side of things too. And
Mhm.
people, especially around here, a lot of times just think of like therapy as reactive, something you go to after you get hurt or after surgery. But, there's so many studies out there that just for musculoskeletal, the stronger you are, the more range of motion you have before surgery,
Mhm.
quicker you're going to bounce back. And yeah, fighting inflammation would be huge, and just feeling better and getting the right foods to heal,
Yeah.
eating enough protein before and after surgery, all that good stuff it's all important. So it's hard to get people to realize that, but
Yeah, and I sometimes send my clients to their doctors for PT referrals.
Mhm.
That happens a lot. because they're like, okay, like I'm off sugar, I'm feeling good, my head is clear, like I've got all this extra energy, I'm sleeping great. I want to go out and like hike. I want,
Yeah.
because we talk about, what are your physical activity goals? Like we need to learn to move in a way that is natural, that feels good, that we can stay motivated. For some people, that's in the gym with a trainer. And for some people, it's like, on the side of a mountain.
Yeah.
So I'm like, what are we going to do? What are you going to do long term to help sustain your healthy habits? So if they're like, yeah, I want to do this, but I have a, back pain or my knee, gets flared up or whatever, then I'm going to say, let's get you to your doctor so you can get some, physical therapy appointments, get your joint strengthened or whatever needs to happen.
Yeah.
And then I know that they're in good care, long term. They can have that relationship with a PT, and then they can, continue to strengthen their body so that they're not going to go out on the side of the mountain and get hurt. So that's pretty important.
Yeah. And just a little, you might not know this, but in the state of West Virginia, you actually don't need to go to your primary care doctor for a PT referral. We're direct access. So you can actually just send them directly to a PT and kind of cut out the middleman there. So
Wonderful.
yeah.
Yeah, that's great.
A lot of states are like that. I know you work with people all over. So each state has different practice laws, but West Virginia for sure is direct access.
So cool.
So tell
Okay.
me about like, what is your like typical demographic do you work with? I know you mentioned OBGYN and moms. Do you work with mainly ladies? Is it all over the board?
It's all over the board. It's probably 60% female. Have a lot of men who come to me and they're like, you know what? I don't know what's going on, but suddenly my bad habits have crept up on me, or I want to be able to go like play basketball with my buddies, or I want to go on a fishing trip and I don't feel good, or like just my doctor's breathing down my neck because he's saying I've got this, might have this diabetes thing. So I do get a lot of men too. Obviously, have a passion for moms because I am a mom. And so I know how important it is for women to lead their families, to lead their children in their health. And so coach a ton of moms. My average age of my clients is probably 35 to 55.
Okay.
And so typically when we're in our mid to late 30s, that's when our health habits catch up with us. People are like, shoot, I can't run around like I'm 20 anymore. And so that's when people come to me and they're like, okay, my bad habits have become automatic and
Yeah.
I really want to create new habits, but I can't do it alone. So kind of, I try to stay with people through different seasons of life, so that, as our bodies change, we can, do a reset if we need to, or, we go through a surgery or have an injury, like, okay, now our habits have to be dialed in because we can't move like we used to be able to, or
Yeah.
I had a baby, or, I've got grandkids now and I'm a babysitter. So that happens across
Yes.
the board. Mm-hmm.
Yeah. A lot of grandparents are throwing their backs out watching their little ones.
Mm-hmm. Yeah, we need our grandparents to be healthy because
Yeah.
they're a strong influence too. My grandparents had a huge influence on my health
Yeah, absolutely.
and everything, but definitely my health.
Yeah, I would say that's kind of like our demographic here too at Faith in Motion is kind of like that mid-30s to mid-50s active adult who isn't bouncing back like they used to when they're in their 20s, but they still want to hike and bike and lift weights and they want to have that nagging shoulder pain and it all works together, nutrition,
Yes.
fitness, health. So yeah, I like we work with a lot of similar people as far as just motivated, want to get healthier, which is awesome to see, especially in the state of West Virginia when we're kind of behind on some of those things.
Yeah, and I think it's important for people to know too, it's not about education. It's not about what you know. It's about helping someone or allowing someone to help you dial in to what you really want for your health and for your life. So I coach doctors and nurses and
Right.
attorneys and engineers and super bright dietitians. I'm not
Yeah.
kidding, super bright people who just need someone to give them the accountability that helps them stick with the goals we've decided together sometimes that they need to accomplish. So, it's not about the smarts, it's about um, the focus,
Yeah.
have someone to help you focus and drive you and push you on those days when you're like, yeah, it would be really easy to make the unhealthy choice, but they know Heather's going to call them and say,
Yeah.
no, we're staying on track. Like we're
Yeah.
going to talk every week and I'm going to keep you on track. That's so valuable.
Yes, that extrinsic motivation and accountability is huge. Very
Mhm.
few people can just like set a goal internally, and
Yeah.
achieve it themselves with no like outside motivation. So, I think finding any type of health and wellness provider that can be that accountability for you. Like you said, you go over health goals with like dietitians, which to some people sounds crazy, but when you do that all day, every day, it's like you just want to turn your brain off and have someone else help you do it.
Yes, absolutely.
Like
Yeah.
I have coaches, I have business coaches, all kinds of stuff. And it's just like, sometimes I need to turn my brain off and have someone coach me. So yeah, coaches
Mhm.
definitely need coaches too. I had a question and then I forgot it. Oh yeah. So what does like the typical life cycle, like someone reaches out to you for like a health screen and then signs up for like a plan of care? What would you say like the typical like life cycle of your customer would look like?
So I work with people anywhere from a month to a year. And I have some people I've been working with for way longer than a year because they get to a certain point in their health and like, let's take it to the next level now. But average would probably be about 3 months, 4 months. I try to help people set some short-term goals and some long-term health goals. So oftentimes, we'll talk. So since it's September right now, we'll talk about right now, what do you want to look like in the Christmas photo? Honestly, because that matters to people.
Yeah.
How do you want to feel when it's holiday break and winter break and you want to run around with your kids and you're sluggish and you're tired and you're drained and um, you know, just what are your goals for the new year? So I try to like set some, like well, obviously 1 week, but 1 month and 3 month quarterly goals so that they can have something to shoot for. And then obviously some people have some big picture goals. So we stay together longer. But if I had to pick an average, I'm pretty certain it's about 3 months.
Okay.
Yeah.
Yeah. Um, and then what kind of got you into wanting to start your own business and like go this route for healthcare?
Well, so I'm an exercise physiologist and I had worked in fitness for a long, long time. And when I started to see that fitness wasn't the only thing that could make a big impact on someone's health, I realized, okay, there's so much more that can be done. And I was a little frustrated, to be honest, working in fitness where, people are having fun, they're getting stronger, potentially, continue to rehab from an injury, whatever. Um, that's great. That's really important, but that's not a whole health approach. I really got excited about the idea about helping people with nutrition, with their sleep habits, with their stress management. And I started to think, like, what if I could just go home with these people and be in their ear and just really, stick to them. And, because the person in the gym only gets an hour with them a day max, right? And so I could be with them the other hours of the day, so to speak. So I got excited about that idea. And honestly, my kids were young and I just wanted to be flexible. I wanted to have my own business so that I could be
Yeah.
able to create my own, professional goals and just also being a native West Virginian. I mean, I'm an Appalachian through and through. I just really am invested in helping the people here, our people, to be a better version of themselves. I hate to see people who are limited in what they can accomplish in life and what they can inspire their kids to do because poor health that's oftentimes related to habits that they can break, if they have some help and support. So I just really love to help motivate people and I love to mentor. And so it was born.
Yeah.
2016, it was born.
Nice. So you've been going strong for 8 years now.
Yeah.
Oh, that's awesome.
Yeah.
Um, do you have like a max number of clients? Like, are you taking new clients? Do you have limited availability? What's that look like if someone sees this and wants to jump on board with you?
Mhm. I am taking new clients right now. I typically take about 4 to 6 new clients in a month. Um, However, the fact that my business is virtual means I can handle more than like the average, personal trainer or a coach who works in an office
Right.
because I do everything on the phone and online. So I coach right now. I'm coaching probably 50 people. But
Nice.
yeah, I graduate people, so to speak,
Right.
people hit
Yeah.
their goals and we start to transition, and I don't schedule as many appointments with them because they don't need me as much. My goal is to help them
Right.
to feel empowered in their health, and they don't always need me to have that meeting with them every week and push them forward. So anyhow, but that's about an average is, I can take um around 4 to 6 new
Okay.
clients a
Yeah,
month, and
perfect. Has
which is
some
fun.
start to graduate, then
Hmm.
bring more
Yep.
in, try to stay around that 50 mark. Okay.
Hmm.
Do you
Yep.
have, is it just depend on the person, or is it mainly weekly check-ins? Is it monthly?
So I do weekly check-ins in general. And so when someone's starting new with me, I understand that a huge barrier is just like learning the ropes of a new plan and like getting over that hump, getting some momentum, you know, of starting something new. So in the very first week, we do 5 appointments together, which might sound like
Okay.
a lot, but I try to keep it super brief
Yeah.
because I want to get in and out. I don't want to keep them too long. Sometimes we have a 5-minute phone call, and that's just me saying, what are your wins today? What are your challenges? How can we work through them briefly? Are you sticking to this? I know it's hard to try new things. How do you feel? Like a lot of times when we drop sugar, we feel kind of some detox symptoms. So there's a lot of getting over the hump in that first week. And then after that, when I feel like they're pretty comfortable, they're more confident in their decisions, then we do a weekly phone call. And that is for me to hear their wins and celebrate them. And if they've had a really crummy week, we can talk about what happened, and figure out how we're going to prevent it. Yeah, I don't ever want someone to beat themselves up if they have an unhealthy week. So we can figure out like what are some things we can implement to make sure that next week is better. And then I'm going to call you next week and see how you did with that. The
Yeah.
accountability is a big piece of the puzzle. And then once people are ready to become more autonomous, I feel like they've got their legs under them. They're making great choices. They're at a healthy weight. They're, maybe come off medicines. That's an exciting victory and a big milestone. Oftentimes, then we can transition to like a monthly call. And then eventually, if some people only get to talk to a couple of times a year because they're just cruising, they're just
Right.
doing great.
Yeah.
And they'll come back to me when they need to, but they know I'm here. So
Yeah.
have an
Which is the
ongoing
goal. Yeah.
support, like a weekly email to my clients. And I have a Facebook group where
Mhm.
they get encouragement ongoing as much as they
Yeah.
need.
Perfect.
Yeah.
Well, is there anything else you'd like to add? Besides what we will go over like your social media and how people can get a hold of you, but is there any other just like last minute tidbits you'd like to add?
I just hope that someone who sees this will assess their personal health habits today and just say, you know what, there's probably at least one thing I can do to get 1% better
Mm-hmm.
and my health. And, I always try to add value to people, even if I do like an initial health assessment intake call. I do a free consult. If that happens and they're like, yeah, I'm not sure I'm ready yet. I'm not sure I'm committed yet. That's okay. Like, I want to
Right.
give them at least one piece of value, one tool that they can implement today. And I don't care if it's drink another glass of water today or just get up and stand more often at your office or take a walk with your family after dinner, whatever it is. I want to give them something that they can start on today because you don't have to have a health coach to start making improvements.
Right.
Will it accelerate your success and make it a whole lot easier, a whole lot more fun? 100%. But people can, start with a little spark of one habit
Mhm.
that they can begin with and start seeing some results. There's a compound effect to our habits for the good and for the bad.
Yeah, definitely.
So yeah, so I hope someone sees that today and just says, okay, all right, what bad habit do I know I need to start breaking? Or, what good habit would be simple to start implementing? So that's my goal today. So, and I love to partner with female business owners, with women in business, because I know you're making an impact there in a lot of people's lives. So this is always a fun thing to
Yeah,
do.
definitely. I
Partner.
like connecting with other business owners in the area as
Mhm.
well.
Yeah, we make each other better.
Yes. So what's your Facebook and Instagram? That way people can look you up.
Yeah, so on Facebook, they can just search Heather Smith, and West Virginia Health Coach should pop up, and just send me a quick note if you want, or just a friend request or a follow. That's great too. And then on Instagram, it's Heather for Health. So Heather, FOR Health, and they can follow me and try to share tips, encouragement, inspiration as often as I can. So yeah.
Yeah, and I follow her on our Faith in Motion page, and then I think my personal Facebook too. So if you guys are friends with me and want to kind of narrow the search down, you can go to my followers or who I'm following and find her that way, because I'm sure there's probably a lot of Heather Smiths in the world.
Yeah, there are a few.
Yeah.
Yep.
All right, Heather. Well, thank you so much, and we'll be putting this on Facebook and email and everything else.
Yeah.
Thanks for meeting with me.
Yeah. Thank you so much. This was awesome. Really fun.